Welcome to the weekly checkup on ReachMD for the week of October 12, 2015. This week's news segment explores the emerging field of gene therapy. A biotechnology startup, Spark Therapeutics, has reported findings of improved eyesight for patients with hereditary vision loss. Despite initial setbacks in the late 1990s following medical complications with several patients, gene therapy research has continued to push forward and is now on the cusp of being reviewed by the FDA within the next year. If approved, this treatment for hereditary vision loss would mark a major breakthrough for gene therapy in the United States. For more information related to this and other genetic topics, head to ReachMD.com. ReachMD's monthly focus on nutrition continues this week with a look at high-fructose corn syrup and diabetes. Food companies across the nation have been pushed to move toward a more natural cane sugar for their products. But are these any better for patients? We investigate this developing feud between sugar producers and where public health stands to gain or lose along the way. And now for a quick look at some of our latest featured content. You've probably already heard about the recent approval of flibanserin, or the female Viagra pill. But do you know what this really means for women with hypoactive sexual desire disorder? Hear from Dr. Cheryl Kingsburg, an expert in the field of behavioral and reproductive medicine, on flibanserin's intended benefits, side effects, and efficacy statistics that are largely unknown. Keeping with the theme of medical breakthroughs this week, Medical Breakthroughs from Penn Medicine outlines the latest advances in minimally invasive and robotic cardiac procedures. Learn which patients are candidates for innovative approaches to mitral valve repair and what goes into creating these new surgical methods. For more featured content, head to ReachMD.com or listen in on iHeartRadio or tune in. On this week's highlighted video segment, help your adult patients get their vaccination statuses up to date with this clinical booster from Dr. Jennifer Caudle and Everyday Family Medicine.
Vaccines are not just for kids. This is something I often say to my adult patients in the office. Vaccines are some of the best protection we have against infectious diseases, and staying up to date is important. In addition, some of the protection we get from vaccines received as a child can wear off over time. So for these reasons and more, we really need to make sure that our patients are properly immunized. So here are a few vaccines to keep in mind. The seasonal influenza vaccine. Yearly vaccination is recommended for all adults. Tdap or pertussis for all adults who have not previously received the Tdap vaccine and for women during each pregnancy. Let's not forget the shingles or the zoster vaccine for adults 60 years of age and older, and the pneumococcal disease vaccine for adults 65 years old and older and adults younger than 65 who have specific health conditions. HPV is for males and females up to the age of 26, and certainly other vaccinations may be recommended as well. It simply depends on the patient's age and their medical history.
For those of you in the Atlanta area, be sure to mark your calendars for this Friday, October 16th. Omnia Education's Women's Health Annual Visit Conference is coming to the Westin Buckhead Atlanta Hotel. Come visit the ReachMD booth to learn more about our available programs and maybe even join us on the air. Until then, I'm Marshall Miller, as always, inviting you to be part of the knowledge.